Judge Moran, and good afternoon to my fellow East Texans. I always like to start these meetings off with just a reminder of what are the symptoms of COVID-19. And they are, number one, fever, number two, a cough, and number three, a shortness of breath. If you have these symptoms, please contact your medical provider, and don't just show up at your medical provider without letting them know first that you're coming, because your medical provider wants to be able to meet you dressed in the proper personal protective equipment. Our other key messages during this time are, we have no vaccine or no medicines for you to take right now for COVID-19. The only thing we have is each other and other public health measures such as social distancing. If you'll notice up here behind me right now, everybody is staying 6 feet apart. And our interpreter over here for sign language is also 6 feet away from me. So please stay 6 feet. That is one of the best things you can do is the social distancing. Secondly, wash your hands for 20 seconds at a time. Third, stay home when you're sick. And I always repeat this. Stay home when you're sick. Even if you have some mild symptoms, if you're sick, you have the chance to transmit either COVID-19 or some other type of disease to your neighbor. I know my friends in East Texas don't want to do things to get their fellow East Texans sick. Fourth, stay away from sick people. Number five, keep your hands off your face, your eyes, your nose, and your mouth. Cover your cough and your sneeze in the crook of your arm. Clean and disinfect the things that you touch, surfaces, your phone, door handles, etc. We're going to talk a little bit about masking right now. The CDC is actually recommending that you use a mask when you're out in public. And again, the mask is not necessarily for the protection of yourself. The mask is actually to protect others from you if you, unfortunately, are asymptomatically, which means you have no symptoms and you're carrying the COVID-19 virus. It's really so important, fellow East Texans, that we stay vigilant with this social distancing so we can stop the spread of this awful virus. And I know from my world in public health, I know these young men and women behind us here, we're all asking you to take make a lot of sacrifices during this time. Please know how grateful we actually are for that. We also ask that you take this time to love your neighbor. Please, you may not be able to see them and have your normal gatherings with them, but don't forget to call them. Don't forget to text them. Use FaceTime, potentially for that family member that may be in the nursing home or assisted living right now that can't come out, or maybe your friend who's just shut in right now. This is a great time to connect and be that light to someone who needs it. We have and we need each other to do these things, and ladies and gentlemen, we will weather the storm. Now, where are we in Smith County at this particular moment? Before I left my office a few minutes ago, they gave me an updated case report. We're currently at 88 cases here in Smith County. And for those of you in the media, you'll have your dashboards with further information on this by 4 o'clock this afternoon. But in the meantime, there's currently 88 cases. Also, there are currently 51 East Texas patients that are currently hospitalized in Tyler hospitals. Now, one of the things that the judge just mentioned to you before I came up here is that we have a definition for guidance on recovery. So how we're going to unveil a number today that basically says how many East Texans have been deemed recovery. And ultimately, the final definition of recovery is if you're a COVID-19 patient, the final definition about when you can start back to work or resume your daily activities is between you as the patient and your medical provider. But for purposes of this guidance and to see where we are with this whole process, our first definition is that there has been at least 14 days since the onset of symptoms, which include fever, cough, and shortness of breath, which I talked about earlier. So 14 days since your symptoms started. Secondly, for individuals who have not been in a healthcare setting, so those who have been hospitalized, etc., when at least 8 days have passed since the resolution of fever without the use of fever-reducing medicine, i.e. aspirin, Tylenol, Advil, those types of medicines. And there's an improvement in respiratory symptoms, such as a cough. Your cough is less, your shortness of breath is improved. So improvement is noted. So with that definition, I'm pleased to announce that we talked to 30 individuals both yesterday afternoon and this morning who had a positive test for COVID-19 between March 11th and March 31st. 30 individuals individuals, of these 23 individuals, or 77% of the individuals contacted, met the definition of recovery. So, at this point, I'm going to ask Dr. Levine, who's to my left over here, a question. What is the process to be considered a recovered case in Smith County, and how is it tracked? Dr. Levine?
So, thank you, Mr. Roberts, Judge Moran, Mayor Hines, and our medical leadership from the community here. In response to that specific question, because in the early stages of community spread of the coronavirus, we've only recently begun discussing and tracking the idea of recovery. First, let me say that recovery from an illness is best determined between an individual and their healthcare provider. This includes recommendations for when to resume various activities and when to consider returning to work for oneself and his or her coworkers in terms of the safety or risk of that person engaging in those activities. Second, we have begun the process in Net Health where our staff follow up with positive cases using the guidance that Mr. Roberts outlined a little bit earlier to classify these cases as recovered. From a public health perspective, developing these numbers and rates can assist public health with monitoring how recovery from illness is progressing, as well as when individuals may be deemed recovered by their healthcare providers and released to these various activities that I mentioned previously. So these parameters were adopted based upon the minimum timeframes presently offered by the Centers for Disease Control guidance for when an individual might be defined as being recovered, as well as when they might be considered as being able to come out of isolation. And since these were all positive cases that we're talking to, they would have considered to be in isolation from the time that positive report came about. I want to emphasize that these are minimum timeframes offered by the CDC. Those that Net Health are using presently are, out of an abundance of caution, longer than the minimums that the CDC is currently prescribing.